Hi guys, welcome back to another series on this YouTube channel, History in Motion. This series will be covering the history of medicine. Starting from the prehistoric era to the modern day, this series will explore how the context of the era influenced their medical beliefs and incentivized medical developments. Today's video will be covering how medicine developed during the prehistoric era. The prehistoric era primarily refers to the period of time before humanity discovered writing, or written history. This period is hard to examine as there is no written records that exist. Instead, historians must use drawings, human bone remains, and prehistoric tools to reconstruct a narrative of the past. Prehistoric medical discoveries were primarily based on trial and error. Remedies would be tried on different patients with different diseases to see if they were poisonous or could have potential medicinal value. Most remedies were herbal and based on vegetable products. Larger, more severe diseases and wounds were deemed to be of supernatural reasons. They were often thought to be caused by evil spirits occupying the patient's body, causing harm. Surgeries were often done in response to these sort of injuries. Historians for a long time assumed that complex surgeries could only be done after humanity developed permanent settlements and started farming. This is likely because humanity lacked the skills and technology to make surgeries possible without infection. However, the earliest known surgery was actually the amputation of the lower left leg around 31,000 years ago. This was still during a time of hunting and gathering, where humans were in constant movement and still hadn't settled down. The fact that the amputation was successful and the boy survived for another few years after the surgery disproves the previously well-founded assumption. Some less rational per se surgeries were developed to cure supernatural causes. Trepanning was one of these techniques used to cure these supernatural diseases. This was the act of cutting a hole, often 2.5 to 5 centimeters in diameter, within the patient's head. They believed that this would release the evil spirits present within the body, curing them of their disease. This act had been witnessed in many parts of Europe in the prehistoric era and also in Peru. Spirituality was not only present within these larger surgeries, but also present in mostly all of the treatments during the time. Even normal remedies were often accompanied by ritualistic activity such as dances, chants, and incantations, and belief that all illnesses were partly caused by religious or spiritual reasons. They thought the remedies worked because of the spiritual reasons, rather than any rational ideas. While many remedies should not have had a positive effect on patients, some still did because of the placebo effect. How the belief in the effectiveness of the medication may cause a psychological bettering of physical conditions. During this prehistoric era where writing hadn't been developed yet, ideas of medication were mostly passed down from generation to generation orally. There was no way to record developments in ideas or procedures to treat certain illnesses. Thus, it was really hard to build up upon different medical ideas because it couldn't be written down and passed on. That is the end of today's video on prehistoric medicine. I hope you enjoyed it. The next episode will continue following the key medical developments of humanity. See you then.